Okay, we're set. So this is our caregiver panel. So I'm not going to introduce them because they're introducing themselves. But we all know that it's not just the single patient, it's the family, right? We use this word affected a lot, which really, really bugs me, because a disorder like Pompe disease or any other one affects the whole family, not just the individual. So we're going to hear some stories about that. It's all yours.
So, hi, I'm Christina Robinson. My mother was diagnosed with Pompe when I was 10, so I kind of grew up within that, and now that I'm an adult, I also serve as a caregiver for her as the disease has been progressing. My full-time job is I am a primary care paramedic in Alberta, full-time in High River specifically. And so Pompe has pretty much been a part of my life as far back as I can remember.
Hi everyone, I'm Lori Boutilier, and I'm from Fall River, Nova Scotia. I have a daughter who was diagnosed in 2017 at the age of 24, and just here to talk about what it was like to be a caregiver for an adult patient with Pompe.
And I'm Taylor Ferguson. My son Levi is 3 years old. He has Pompe disease. He was diagnosed at 13 months, and yeah, that's now my job is just be his caregiver. Chris, what is it like being a caregiver for a parent with Pompe, and how does it shape your family's day-to-day life?
So when we got these topics, I spent a little bit of time thinking about them because as far as I can remember, like Pompe has been a part of our family. Like I said, I was 10 when she was diagnosed. So growing up, becoming a teenager, all of the things. At that time, she was fairly independent. It was only in the last 5 years we decided that things have started to decline. She's needed more assistance and all of that. So to me, everything was just kind of like a normal childhood type deal. I went to university in Saskatchewan. So I wasn't at the house and for pretty much since 2010 until recently when I moved back in full time as of last year. So with all of that, basically, my experience with Pompe at the start was basically like every other kid. We just knew if something happened, then I would have to be pulled from school or have to, assist. If she fell down, I'd have to come and pick her up type deal. So all of that. And then as I've gotten older, the role has kind of progressed. We do more patient transfers because that's the term that we use at work. So basically, I do all of the transfers out of the wheelchair now onto the beds or anything like that. She still maintains as much independence as she can, and I fully encourage it because if you're not using the muscles, then you're losing them. So there's that. So how it has really changed our day-to-day activities. I work full-time nights, so her routine has kind of developed more to be similar to mine, that we don't get out of bed until well after noon because I don't get home until the middle of the morning type deal, that we get up usually at 2 and we go to bed at 5 o'clock in the morning. So she's kind of just adapted that way. And she knows that if 911 is needed, her daughter may be the one coming in the ambulance now, so.
And is your mom what inspired you to be a paramedic?
I grew up in going to all of her specialist appointments, so in all of those formative years, I think I met 23 different specialists at one time, ballpark. I would then ask them, how long did you go to school for? And all of that. So I knew then I wanted to be in healthcare. I didn't know exactly what part of healthcare I wanted to be in. I found out from the neurosurgeon that I did not want to be a neurosurgeon and go to school for 18 years. I still kind of did because I'm a professional student, but that's entirely different. I did not want to do that. So originally I wanted to be a trauma surgeon. So I went to the University of Saskatchewan in Saskatoon. I got a bachelor's degree in essentially pre-med in physiology and pharmacology. Then I applied for med school. I did not get in right away. So I came back and I did a ride along with Calgary Metro EMS at the time. Fell in love with the ambulance. There is more autonomy and all of that. So from a young age, I always knew I wanted to be in healthcare, but I didn't know where I would fit until later on. Okay. So next up, Lori, would be, how has your role changed as a parent and caregiver as your child has gotten older with the years? I know Alex was diagnosed at 24, you said. So she was already an adult, potentially moving out, all of the fun stuff. How has that impacted your guys' relationship?
So yeah, Alex was 24, so my role as a caregiver would have looked much different had she been a child. But it was still something scary, unknown, that we were going through together. But I think my role was far more, in the beginning, advocacy and support. I was making all the phone calls, researching, determined to get her treatment. And that's what my role was. Went to every doctor appointment with her. And it's kind of funny because her diagnosis probably came quicker than a lot of people's because her father's family had a history of muscular dystrophy. So from the time of diagnosis to her first treatment was literally months. So she started her treatment in a clinic. I was there with her for her treatments to support, run and get her food. They then transitioned to my place in Fall River. And again, I was there just to support her, more of her gopher than anything, running to get whatever she wanted. But just always being there for whatever that she needed. She now is married. She's living in the Valley and just transitioned to home care infusions in the Valley, which is probably an hour and a half from my house. So I kind of had to take a back seat, which could be really hard because as a parent, you just want the best for your kid, and it's hard to step back sometimes, but I have done that. She's become a little bit more independent, advocating for herself. She's now expected a baby. We're gonna have a baby the end of October, which again, that, you know, in most families, that's nothing but joy, but it came with some trepidation, lots of fear, lots of sleepless nights. You know, I did the same thing that everybody does. I got on my computer and I started Googling. What you can find is so little information because there's such a small group. But one thing that was consistent was that her Pompe symptoms would get worse, and they did. But she has done so amazingly well. Just like everything in Alex's life, she kind of meets it head on, and she made really good decisions. She kept her weight at a really good, weight gain was really, really good. Due the end of October, and they're hoping for a natural birth. So that is, that's the excitement in our family right now. We've kind of come full circle. Because now I'm watching my baby have her baby. So that's, so I'm more of a support. I started out as the driver and I'm now the passenger. Myself and my family are just there to support her in any way that we can. Okay, Chris. No, sorry, Taylor, sorry. What was it like to receive your child's diagnosis, and how did you navigate the early stages of treatment and care?
Well, obviously the diagnosis comes with a little bit of panic, like Pompe disease, what is that? Like, what does that mean for his future, for our future? But for us, it also came with a lot of relief. We had noticed from when he was born that he had some symptoms, low muscle tone, his mouth posture, he had an enlarged tongue. We tried tongue tie releases, we did private physios, we did all these things, and we were always told,
that we were being overly cautious and everything was fine. He would grow out of it until he was diagnosed at 13 months. They took him for an x-ray after he had a fever and noticed his severely enlarged heart and sent us straight to MAC. There, luckily, we met Dr. Tarnopolsky, very incredible physician. He absolutely knows everything about Pompe that there is to know. So when he walked into our hospital room, he looked at my son Levi and he said, "Oh, it's Pompe disease, 100%. Like, we'll do the test, obviously, because we're not just gonna willy-nilly that, but Pompe disease." So we're like, okay, cool. We went home finally and stewed for a little while until we got our diagnosis. And then once we did, we started treatment within 2 weeks. The hospital set up everything for us. We didn't really have to do much, which was amazing, because as a parent finding this out, you're like, okay, what do I do? What steps do I take? Who do I talk to? And of course, your family doctors, they might not know about it. They might have heard it for one day in med school. The biggest help was the online community, reaching out to Brad. I spoke with him very soon after diagnosis and immediately felt so much better. And then going for treatments, he was going to McMaster every other week. We were there all day, stuck in his little hospital crib. And at the time, I wasn't able to return to work because he had all these appointments with testing and treatment and physio and all those other things. So everything kind of changed at home. My husband was still able to go back to work, which is great. But then that meant me and Levi, every other week, we're heading to MAC. We were just kind of getting by however we could, which is hard. Like, you go on your mat leave, you're like, okay, I'm gonna go back to work, everything's gonna be normal, and then everything changes. So it was hard to navigate, but we got through it. Every day gets easier and easier. Now we found our new normal, and he's doing amazing. And I don't know how, because I couldn't do what he does, but yeah.
How do you manage, like, explaining that to, I mean, Alex was an adult, so how do you manage explaining the process to somebody that young?
It's really hard. At first, he was only 13 months, so he didn't really know what was happening. Now that he's 3, he's starting to understand a little more. Like, when we're getting ready in the morning, he's like, no, I don't want to have my numbing cream on. No, I don't want my teeny tiny poke. And I don't blame him. I wouldn't want it either. So we're trying to navigate his new understanding of this Pompe world and just telling him, like, it's not something horrible. Like, yes, you have Pompe disease. Yes, it's going to be challenging, but you're strong. I tell him all the time, you're brave, you're strong, and you're smart, and you can get through anything. So.
All right, so I'll ask both of you. So Taylor, you can go first because you still have the microphone. But how has Pompe shaped your family's day-to-day life?
Well, as I mentioned before, like, I wasn't able to return back to work full-time. I was a toddler educator, so going back full-time daycare wasn't possible. He's got treatments, he's got physio, he has all these other things. Going back to work part-time in childcare means a lot of germs. Everything in life has changed now. Like, everything is about keeping him safe, keeping him happy, giving him the best chance he's got. So our day-to-day is kind of just, Levi tells us what we're doing, where we're going, and we go
And you
through
get
it.
bossed around.
Yeah, pretty much. That's, the toddler life.
I was going to say, that's about normal for 3 years old, isn't it? And yourself, Lori?
I guess it's more of an emotional perspective than changing our daily lives. My family, we just accommodate, we change things around, we move things around, we do whatever we can to accommodate her many appointments. But other than that, in the early days, it affected us much more than it does now. If you were to ask Alex, her complaint would be the many, many appointments, and especially when you're coming an hour and a half, and I know some people probably travel further than that, but for her to get to any hospital, it's about an hour and a half drive, and on top of her regular appointments, she is now making pregnancy appointments as well, so everything is doubled. But as a whole, it's more of an emotional component for our family than anything else right now, yeah. Okay, here's a question for both of you guys. What do you know now that you wish you had known sooner?
Well, for us, it's a little bit different because like you guys got diagnosed significantly later. Like Alex got diagnosed in what, 2024? No.
Oh, 2017.
2017. No, which year? In 2017, and then
Levi
Levi's
was 2023.
2023. So the diagnosis process from 2002 until both of those, so many things changed in the community of rare disease and Pompe, and so many things exploded with research and treatments and all of the things that one of the things that I think those who were around back then wish we could have had sooner would be the treatment options and having it so that when you walk into a specialist's office and you say, okay, so I was just diagnosed with Pompe disease, that the entire room doesn't look at you and be like, hey, what's that? Because as a patient, now you have to then also be your advocate. You have to be the expert, and you have to teach the people who are supposed to be helping you help you, because you don't really know how to do that per se. Like when my mom was diagnosed, one of the things that they said was, okay, you got to eat like 3 times your body weight in protein because there's nothing else that you can do. So some of the things like the enzyme replacement therapy, the gene therapy, the substrate reduction therapy that have all come into light more recently are game changers for the newly diagnosed. And a lot of the things that we wish we would have known would be like the things of, you look back, hindsight is 20/20, right? So you can see the symptoms further back. Like my mom said, she's never done a sit-up in her life. She was always the last one to get back to the house walking home from the bus type thing. That when you're looking back at those, all of that becomes more difficult. From the caregiver perspective, it's become more evident recently that sometimes you got to take a step back, right? So between trying to not make it your entire identity, like how Sam was talking about this morning, like you don't want the caregiver role or the patient role to just define you. You are your individual person. This is something that is happening, but you don't necessarily have to make that your entire identity. You can still have a full life outside of that. That, like, one of the funny stories, and I know many people in this room have heard before, but when mom was more able-bodied, we had the awesome sense of humor where it was like her parking at Safeway parking lot with the handicap sticker, getting out, walking to the store, and someone thinking that they know better, being like, well, you shouldn't park there, you're not handicapped. And her look at them and be like, well, you didn't look like an idiot either, so I guess we're both wrong? And then immediately texting me and saying, hey, I might need you to come fight someone in the parking lot for me because if I fall, I'm screwed. And then you got to be prepared of, oh yeah, so people suck and I guess I'm going and maybe fighting. But we'll see how this plays out.
Fights in the parking lot something I have to look forward to as a caregiver? Is that part of the job?
I mean, you got to be prepared that you might have to, but I haven't had to lay a finger on anyone. Usually you can talk your way out of it and have a good sense of humor about things, so.
Something that I wish I knew, I kind of knew, is you are the best advocate for yourself, for your child, whoever it is that you're caring for. If anyone knows, like, mom gut is a thing. Like, if there's something going on with your kid, you're gonna know. You're gonna wanna find answers, and you're the only one that can push for them. And don't give up when you're told, no, you're fine, you're a first-time mom. Like, push and advocate for yourself, advocate for your kids.
Yeah, the advocacy thing, just recently, Lori had a gallbladder attack. So she was actually taken to urgent care first because we wanted to make sure that it wasn't a heart attack, because women present differently for chest pain and all of the fun stuff for heart attacks. That we went in, the ECG came back clear, but her gallbladder enzymes, when they did the blood work, were through the roof. And they're like, yep, so your gallbladder has to come out. We're going to send you to Calgary, to the hospital there. Surgeons walked in, they're like, okay, so your surgery is going to be, and we're like, no. Have you talked to our specialist? And the surgeon's like, well, I've never had any issues, so I don't need to. And we're like, no, full stop. This is not a thing. You can leave, and when you come back, you can have this conversation with the specialist. And being able to be that hard line in the sand when patient can't, like your family member can't be that advocate, you have to be able to be the mean one and say, nope, you don't have consent, so
And
walk
meet you
away.
in the parking lot?
Yeah, pretty much.
We're back to the parking lot. Anybody have any questions?
I love microphones. So I'm wondering if each of you can think of one moment when you said to yourself, wow, this is real. Like I know for me, when I was diagnosed, I was pretty healthy. Like I was going to the gym twice a week and things were pretty good. It took a while to get diagnosed, but when I was diagnosed, I was actually doing really, really well. But then later on down the road, when I started to decline and I needed treatment and needed the BiPAP and everything, that's what made it real to me. Beforehand, it just kind of just wasn't so much. I'm wondering if you had a moment like that.
I did, but kind of the opposite. Not like, oh man, like things are getting bad. When Levi started treatment, right away, every infusion, we noticed something change. He had a really hard time eating, swallowing, a lot of choking episodes, but every single infusion, something changed. He could crawl better. He could, when he was starting to speak, it just got clearer. Every infusion, something, he learned so much more, and it was incredible to see. And like, wow, this is working. This is going to change his life.
With Alex, it's funny, because when your child's diagnosed that late, you wonder if you missed something. And you go back and you go back, you go back. And the only thing that I can remember in her childhood that ever stood out, and this is going to seem really small, and it seemed small to me at the time, but here I'm talking about it 33 years later. She used to take ballet. She was 7 years old, and she was in dance class, and parents came in to watch the kids dance, and they were all sitting. Taylor, can you hold the mic for me? Because I'm going to have to show you guys. I've got my glasses. So they were all sitting in a circle, and their toes were all touching in the middle. And every child was sitting like this, but Alex was like this. And I noticed it, like it looked odd to me because everybody else was sitting up straight. It looked odd to me, but I didn't think anything else of it, about it. And when it really became an issue, her and I were walking outside. She used to walk with me quite often, and she couldn't keep up with me. And I looked back and I said to her, I said, on Monday, you're making an appointment with Dr. Colleen, who is our GP. And I said, you're going to tell him that you can't keep up with your 50-year-old mother. I said, that's an issue. And, I was kind of angry about it. And she did that, and she went to see him, and he sent her to the rehab clinic. And I thought, well, that's a bit extreme. Like, there's nothing that wrong. Like, give her a pill, fix her, she's fine. And she went to that appointment by herself, and they told her at that appointment that they were 90% sure she had muscular dystrophy. She called me from the appointment, and I just about lost my mind that they, even though she's an adult, how dare they tell my child she has, like, that is terrifying. I know what that looks like. I saw what that looks like. Anyways, it became really real then. I went to the next appointment with her, and I thought they had just made a mistake. That, you know, they're wrong, this is a mistake. And when we walked in that room, there was way too many people in the room for it to be nothing. And there was one of the doctors that made the comment, and he said, you know, I watched them do the strength test and various tests with her. And there was one doctor, and he made the comment, and he said, I don't know what you have, and I don't know if you have the misfortune or the good fortune of having me completely enthralled with whatever it is, because he said, it's not familiar. So that was kind of the aha moment that, and then we found out after that they ruled out, I think you can only rule out 8 different types of muscular dystrophy. They ruled that all out, and the neurologist came in the room and told us that, and, you know, that was probably the only moment as her mother that I broke down, because that's so good, and her neurologist, Dr. Grant, who's absolutely wonderful, said, I know you're relieved, but this is something. And then he said, going to do this little test. I know she doesn't have it. So rare, never seen it in my career. Going to do this little test for Pompe. It's just a quick blood test, and we'll see. And it came positive. He thought it was a false positive. They did another one. He thought it was another false positive, and he still wanted to see the DNA. And, well, the positives were positive. So that was the aha moment. Yeah, kind of a few of them. Yeah.
Yeah, I'm not really sure if I've had like an aha moment, because like I said, this has pretty much been as far back as I can remember. This is what I remember type deal. But from the work standpoint, like as you get older and you have kids, you hope that your kids will be there to take care of you when you're older. That kind of more of like an aha moment is that my mom gets to have that earlier than most, but also at the same time, there's in my work, you see so many people who don't have that their family is there, but they don't care. That they're like, oh yeah, okay, so you have insert disease here or insert ailment here. I'll see you in a week. Or they just don't come for the visits type deal. So you see that a lot more, that we don't tend to see that in the rare disease side as much. Rare disease side, we're more hands-on of, okay, we have this little community because we are little, but all of that type deal, that even my coworkers, when I said that I was going to be on a panel in a conference this weekend, they're like, I've never heard of that. And so we kind of did the elevator pitch type deal of, what is this? Can you tell me more? Is there a way that we can watch it online or something? And I was like, do we really want you to watch this online? I may fail, but we'll see. So I'm not actually sure who's all watching, but they might be. Hi, guys. But yeah, so I don't know if there's like a real Pompe specific aha moment for me, but.
I just want to reiterate that, Chris's point, that like whenever you're feeling like your best isn't good enough or whatever, just know there are really, really crappy people out there. Because I also have ailing grandparents and stuff, and I have friends that work in churches, and they see what you're talking about, where, you know, I don't know, I feel like to sort of hearkening back to Sam's point earlier, that it's easy for us to see the way that we fail, the way that we don't show up for people. And something that is amazing about this community, as well as the broader rare disease community, is that we, as caregivers, as friends, as family, like we just show up because it's the right thing to do. And I think we should all really applaud ourselves for that.
Any questions online there, Victoria? No? Okay.
So I know that, nobody would ever wish Pompe or another disease on anybody else. But, thinking about what Sam said and, how life's challenges, you have to build resilience. So I guess my question to you is, tell me a silver lining. What is something that you have experienced or now see differently because your family has been affected by Pompe? What's a positive?
I always say, I'd rather not have met all you guys. But that's the silver lining, is meeting all these people and the friendships and the network and the support. All of that is definitely the silver lining. Yeah.
But Lori, we're awesome.
We're fighting in the parking lot later. Anybody want to come see?
To go along with that, yeah, the network, the people. I'm lucky enough that we are able to go next weekend. We're taking my son to the States. They have an infantile or pediatric family Pompe meetup there. And seeing all those kids get together and play and interact and feel at home and comfortable, it is like a whole different world. There's other kids Levi's age. He was able to play with them in the sand, and they talked about their ports, and it was just incredible seeing him shine with other kids like him, and just so lucky that we're able to do that.
Yeah, so I'm gonna bring it back a little bit. One of the things that I would say for silver lining is the advocacy part, that through going through all that we have, yeah, some of the things become your new normal, but at the same time, when the normal and the standard gets questioned and you know that things are different, you are better able to advocate for yourself, right? So with all of the patients that I pick up on the ambulance, the last thing that I say before I leave the ED is ask all of the questions. Be the most annoying patient. If you have questions, ask them, because you know your body better than they do. And so if something's not right, ask. Say, is this supposed to be like this? Because this is my experience. And don't let them shrug you off, because ultimately you're your best advocate. So.
Hello, I'm one of the physiatrists, so I'll be talking next about strength training. I guess you made me wonder how many times I've said things that then people remember the words that I've said, and I don't like the impact of that. So I was wondering if you had any advice for the healthcare professionals that you interact with.
If you don't know, don't pretend like you do. And that is advice that I have to take myself a lot of. Our, as healthcare professionals, tends to be that our ego is a little bit here when it should be sometimes here. So just making sure that we're kind of doing like the closed loop communication type deal of, did you have any questions, no matter how silly they may feel, because this is your time to be able to ask them, is kind of the standard that I kind of preach a little bit, but.
That's kind of what we tell different doctors and specialists when we go in. They'll ask us what Pompe is. What does that mean? How does it affect him? Ask those questions. Ask what's up, because even then, like, every patient is so different. It affects everybody so differently. So just ask. We're all open. We're all willing to talk about it and share, because we want the best care we can get as well. So.
Yeah, this week I had a new partner. She was filling in for my regular partner. And like I said, all week I've been pretty much telling the normal crews in our hall that I have to do this and I don't know what I'm going to say, and still didn't know right while I was walking up here. But so with that, one of them was like, if I'm getting too personal, like, tell me to stop. And I was like, no, I'm an open book when it comes to this. If I don't know, then I'll tell you I'm not sure and let me look it up. But aside from that, like, we're as approachable as you can be type deal, right? So a lot of us, when you're first diagnosed, yeah, you have all of the questions. And if you ask me the question and I'm newly diagnosed and I have no idea, I'm going to look at you like a deer in the headlights because you're supposed to be the expert and I'm here to help, like, ask you. But that's kind of where the, like, networking of, there's the CAP, there's the other specialists like Ternopolsky, Dr. Kahn, all of the things that being able to ask a friend is one of the better things. If you don't know, ask type deal. And I know Dr. Kahn and Dr. Ternopolsky, I'm sure, would rather you call them and ask them the question than try to pretend like this is going to work regardless of if it's beneficial or not.
The only thing I would say, a couple of the experiences I had when I was with Alex is because there are so many physicians who don't know what Pompe disease is, they can be dismissive, like it's not important, or like it's like an eye infection, or they don't understand how serious it is. We went into Emerge one day because Alex's migraine was so bad, and so we went in for that. And I tried to explain to the doctor. I said, "Well, she has Pompe disease before you do it." He said, "I have no idea what that is," and he walked away from me. And when he came back, I said, "You can't do anything until you know what that is." So we've experienced that a few times, just being very dismissive. Like it's not a big deal, because it's a friggin' big deal. It's multifaceted. It affects so many things. So yeah, I guess that's my 2 cents. Yeah.
Sam says you're doing great. Thanks.
None of us passed out.
None of us